Hi everyone, this is Dr. Fred Macy. I have been asked recently, what is my approach towards diabetic management? And we're speaking about type 2 diabetes. Well, first, we must start with lifestyle. That means your everyday activity program, at least 30 minutes of walking or more strenuous activity if you're able to do more, 5 times a week or more. Also, your dietary choices. I prefer the Mediterranean diet, which is predominantly plant-based, with olive oil, avocados, low-fat meats, portion-appropriate alcohol, especially red wine, some mixed nuts, whole grains, and there you have it. Those are the lifestyle modifications one must make. But there are a couple of others that I'd like to put in there. One is strategies to mitigate stress. That is, the ability for you to self-control your stress level. And that means embracing certain activities every day that allow you to reduce your stress. What are those? First, try to sleep at least 7 to 8 hours uninterrupted. That means putting away your phone. That means putting away the television or turning it off. And before you go to bed, try to meditate for a few minutes. Perhaps read a good book. If you're spiritual, the Bible is a great read. What other activities? Hobbies. You need to be the creator of your own de-stressing. So if you paint, if you write, if you sing, if you love music, if you love puzzles, if you love gardening, do it. Try to do it often because these activities are for self-preservation. All of this goes to your brain, meaning your neurotransmitters are going to work together, what I like to call DOSE. Dopamine, oxytocin, serotonin, and endorphins. We've got to have a balance of all of these. And the lifestyle I was just discussing promotes all those. And there's the other component, which is connecting to others, whether it is your family members or friends or your community, volunteering. All of this generates a positive lifestyle that de-stresses you. And you need to do it regularly. That means you need to be consistent. Now, some people, of course, need medications. And there are only 3 kinds of medications that are known to decrease cardiovascular outcomes. What does that mean? You want to be on medications that decrease the risk of strokes, heart attacks, congestive heart failure, being hospitalized for congestive heart failure, or other cardiac issues. And last but not least, that decrease cardiovascular mortality. So what are these drugs? Well, first of all, it's the SGLT2 inhibitors. I don't want to go into the names of them right now, and since this is not a pharmaceutical talk, but you should ask your provider why you should be on one of these drugs. Another type of medication are the GLP-1 receptor agonists. Again, they have a very positive profile in preventing the cardiovascular issues that I just mentioned. Lastly, metformin. Metformin is affordable, usually well tolerated, and has been around for well over 25 to 30 years. And we have some data that it does decrease the microvascular complication of diabetes. That is, diabetic retinopathy, diabetic nephropathy, and peripheral neuropathy. So these are the only 3 classes of drugs that have been shown to decrease cardiovascular outcomes. So if you ask me, should I be on insulin? And the answer is, you should try to get off insulin. Insulin is more of a neutral drug, and it doesn't increase or improve the risk from a cardiovascular perspective. So you should try to get off it. And so in the end, other medications are not helpful to decrease the cardiovascular outcomes I mentioned. So my approach is more holistic. It starts with you, that is your lifestyle, de-stressing, positive activities every day, proper sleep, avoiding excess alcohol, 1 or 2 servings 3-4 times a week, no more, walking and or other form of exercise, and the de-stressing activities I mentioned, especially connecting to family and others. And lastly, the medications I touched on briefly. And that is a comprehensive way for you to gradually improve on all the parameters that over a 5 or 10 year period, you can definitely demonstrate a dramatic decrease in poor outcomes. So that's my approach.